Is COVID coming back? We literally just opened up like a month and a half ago, but it already seems like things are starting to get out of control again. My name is Conan Liu. I'm a resident physician at UC Davis. And I just wanted to give my 2 cents and my perspective on how bad this new surge of COVID is. So the short answer is yes, COVID is coming back, and I am quite concerned about it. Last week, I was called in multiple times to provide backup for colleagues who were testing positive for COVID, even fully, completely vaccinated people. And in terms of the patient populations, we are seeing a huge uptick in cases. And I'm also noticing a lot more hospitalized patients and even ICU patients. It's really starting to feel like November and December of 2020 again. The good thing that most of the people who are testing positive and have been previously vaccinated really are not having many symptoms at all. They're maybe having a little bit of fatigue or maybe just not feeling that great. A lot of people are just completely asymptomatic, but because they test positive, they had to get pulled from work for 10 days. But there's a lot of patients who are starting to get sick again, and there's a lot of evidence that this new variant is a lot more infectious than the previous one. So I just want to show this article that's saying that the Delta variant is 40% more infectious than the original COVID-19 strain. And this is all based on this R0 value, which is a mathematical term describing how contagious an infectious disease is. And so the original COVID-19 virus had an R0 of 2.3 to 2.7. So one infected person would be expected to infect 2.3 to 2.7 people. This current variant, the Delta variant, has an R0 of 5 to 8. And I've actually seen some reports of the R0 being up to 9. So honestly, this is like 3 times more infective. I don't know why it says 40%, but it seems like it's 3 times more infective than the previous versions. We're definitely seeing a huge uptick in cases. If you just go on Google and look at COVID rates, you can see in California, we had this big surge, November, December, and January last year. That's when the ICUs were all super packed. And it's really starting to increase again. Now, if I change it to all of the US, you can see we're starting to get like 100,000 new cases a day again. And it's really just exponentially rising. So I think now we've gotten some better treatments. And so patients are doing better mortality-wise. But moving forward, I'm definitely going to start wearing an N95 all the time in the hospital when I'm seeing patients. And I'm going to stop doing social events because this is just crazy. And so many vaccinated people are testing positive too. So this is definitely hitting. So that's my brief answer from a resident physician's perspective on whether or not COVID is coming back. In my opinion, it truly is. We're seeing so many more patients. The ICUs are starting to be filled with ICU patients again. I have seen some vaccinated patients who are in the ICU. So even though you're less likely to get severe disease, there is still a small risk. So I think it's really prudent to really start taking precautions again, maybe start wearing your mask in stores again, which I'm already seeing people do, and just really kind of be more cautious with some of your social gatherings. So take care of yourself, make sure you get vaccinated, and we'll see how this next wave goes, and I'll keep you guys updated. Thanks for watching.